And then how about the workshop and the government? Or you basically that were left for me to do. Not left because they were supposed to do it, but because they didn't do it properly. So I'm trying to fix it. It's the hardest.
Time check.
Like, you know their job. They were like, oh, this is like, I know it's like, oh my god. You know what I mean?
3 minutes. We'll start with review first before presentations, so make sure you have your lecture packets handy with you. Law only, you did the inventory. And you've listened to these audio lectures. I will stop the review if no one gets to answer any of my questions. So, at least one kept answering, we're good. Did you say you got us, Kathy? You know, Kathy has a full-time job too. Yeah. So she can do it with a full-time job. There's no excuse for you guys. 1 minute. I don't have my watch. I keep forgetting. Maybe because I was wearing long sleeves for days. Long sleeves. It's not as cold today. It's very cold. It's not as cold as yesterday. Classroom is cold. Time check. It's 8 a.m. Good morning, pharmacy. Good morning. Happy Friday. Yay. Whose Friday is it?
Everyone.
Yours? Everyone? Okay, everyone's Friday. Jessica, I know it's not her Friday. The people who work weekends only, it's the beginning of their work week, right? Okay, so we'll start with review of final exam first. Pharmacy law. Why? Because some of you go over the 15-minute limit presentation, okay? Which is okay. It's just that right now it's a Friday and Monday is finals. So we don't have that luxury, okay? So I want to prioritize the review instead of putting it at the very end, okay? If you have, I'm going to tie it with a PTCE, not just for final exam, okay? If you have the PTCE content outline, pull it up. You should have put this in your binder with inside a protective sheet. I always leave a copy inside the book, okay, so that I know. Okay. This is what you call the blueprint. You may print this from the PTCB's website, ptcb.org. Okay? And this is the content of the PTCE. This is the content outline. Medications, that's why I harp on this all the time, is 40%. You see that? Okay. Federal requirements is 12.5%, which is what we're going to do right now. Okay. I've been noticing whether students here, okay, in the night class, and students who are on my online review class, not here, one of their weaknesses is law. Okay, first is medications, because there are many, I think, tutors or instructors who just harp on memorizing brand generic class. And you got to remember that content number 3 is patient safety and quality assurance, which is 26.25%. So you can't just be memorizing these drugs. That's why I harp on drug to drug, drug to food, because this involves safety of patient. Drug to supplement interaction, drug to disease interaction. And where can you find that, Handy? Right here at the back. Pages and pages of what not to take, what food interacts with what, okay? It always, always, always shows up on the PTCE, and it's scored under patient safety, okay? So with medications, 40%, and patient safety and quality assurance alone, that's 40 plus 26.25 is 66.25% of the content. These are the 2 heavyweights, followed by, okay, the 2 heavyweights, so it has something to do with drugs. You think calculations fall under patient safety? Of course. Wrong calculation may lead to? Sometimes it's not death right away. A lifetime of side effects. But I always say that, because we always say coma or death, right? That's one of the side effects, okay? But we always say, I say, I'd rather be dead than comatose. Okay, because I don't want to burden my family. Okay. Next one would be order, entry, and processing. We're doing inventory and law and ethics right now. You think order, entry, you think inventory falls under order, entry, and processing? Yes, totally. Whatever project you did with inventory, okay, falls under order, entry, and processing. What about pharmacy tech duties? You reading the prescriptions, me giving you chicken scratch prescriptions. Is that order, entry, and processing? Do you think that will fall under patient safety and quality assurance as well? Yeah, misinterpretation of the prescription, okay? The calculation of day supply and the quantity to be dispensed fall under patient safety and quality assurance. For the next hour, we will focus on federal requirements. So let's start. Okay. I'm giving you everything you need right now. So, okay. I got stickers.
Those are prizes?
Prizes. Okay. But only for the first batch. Okay. Because I don't have a lot, but due to insistent public demand by my students online, maybe this can be available later. But because it's Friday, you worked hard, and finals is on Monday. I didn't realize that the batch of stickers that I grabbed has a lot of future pharmacists. So if you intend to be future pharmacist, I can give you that sticker as well. Okay? But if being a pharmacy technician is your entry into another medical field, I'm not asking you to be a pharmacist, okay? But it's a very good starting point. A lot of technicians don't leave, okay? They advance and advance and advance, but stay in the pharmacy industry or career field. Okay, let's start. Child-resistant cap. You remember this from the audio lecture? Okay, Child-resistant caps for medications are mandated under what law?
The Poisoning Prevention Act.
Poison, very good. Poison Prevention.
Packaging Act, there you go. Of 1970.
Okay, I was about to give a tip, 1970, but I didn't have to. Can you read the full title of the act?
The Poison Prevention Packaging Act.
Poison Prevention Packaging Act of 1970. This law always shows up on the PTCE. Okay? All prescription medications must be in a child-resistant cap, be it liquid. We have child-resistant, right? Where you push before you twist. Okay? Or solid capsules, tablets, wherein most pharmacies have it back to back. One side is child-resistant. If you flip it over, it's just a screw, non-child proof. And what does the law say? Children, what age? 5 and younger should not be able to open the container. Okay, however, when we can't open a container, we tell our kids, could you open this for me, please? Okay, yeah. This is also Rainey presented about fentanyl, right? They're very colorful. You see, our drugs are very colorful. And that's why we should have every single prescription meds in a child-resistant cap. There are exemptions. You heard me talk about this, and these exemptions always show up on the PTCE, okay? There's 3 major ones, 3 to 4. It's on my lecture packet, and it's on my audio lecture. There's 3 to 4 exemptions on the child-resistant capping, okay? Of course, you will have to document and put notation if your patient comes and says, I have arthritis, I cannot open a bottle, put that in notation. Dispense the non-child-proof cap, okay? The bottle in a non-child-proof cap. I have carpal tunnel syndrome. I'm by myself. Document and dispense that. But there are 4 exemptions to this law. 4 that always show up on the PTCE. First one. Inhalers, because you do not repackage inhalers, okay? Inhalers doesn't always show up. Okay. Next. Contraceptives. Why? We do not repackage contraceptives. It's numbered 1 to 21 or 1 to 28. Ladies, can you agree? Yes. Justin probably is agreeing because he sees it from his girlfriend. It's numbered 1 to 21 or 1 to 28. Okay, so you do not repackage that. You dispense that in the original manufacturer container or bottle or blister pack in the case of contraceptives. What else? Huh? Powders. Okay, this show up on the PTCE. Powders, example, cholestyramine. Okay, powders like cholestyramine. We don't dispense the powder, and we don't repackage the powder and dispense. We dispense them in their original pouches or packets. Okay. And the last one, this is the one that always shows up, no fail. Nitroglycerin, but it has to be sublingual. Okay. Why? What does nitroglycerin sublingual tablets do? Angina. Not vagina, angina. And mates were laughing when they first heard the word angina because they thought the instructor said vagina. Totally different. Okay, what's angina? Chest pain. Okay, so nitroglycerin is for chest pain. It is an emergency drug. Okay, when a patient feels chest pain, probably thinking a possible heart attack, the patient should put that nitroglycerin where? Under the tongue. That's why it's called sublingual. Okay, and you have to remember this about nitroglycerin. Nitroglycerin always shows up on the PTCE. How do you take nitroglycerin? Well, there are patches. They're sublingual, but the sublingual, how do you do this? Place one under the tongue. When's the next dose? 15 minutes. Very good. 15 minutes. 3. You take one, place under the tongue, wait 15 minutes, chest pain is still there. Take another one, wait 15 minutes, chest pain still there. Take the third one, call 911. Always shows up on the PTCE. Another one, how do you package nitroglycerin? They come in their own bottle. I heard you were talking about amber container bottles, right? They're little bottles. They have to be in an amber container bottle to be protected from what's our three things?
Humidity and
Remember the alt key. Alt key. Remember the alt key. Okay? Air, light, and temperature affect stability. Does price affect stability?
no.
That's always the answer, except for price. Pharmacies can price it whatever they want. Okay? Air, light, and temperature. Okay? And must have a cotton pad inside or cotton ball inside. So the manufacturers do that. Okay? And because it's an exemption, it should not be in a childproof container. Okay? Headline. Patient died because a pharmacy technician repackaged it in a childproof cap. Should be able to open it right away, place the tablet under the tongue. Speaking of emergency, I ordered a crash cart and it's here. It arrived yesterday, a real one. That was our makeshift and that's the real one. And so since inventory project is going to start in the night class and you guys are done with it, Ms. J is going to have the night class feel the emergency card or the crash card. Emergency drugs only, okay? Jessica.
What is the cotton ball?
Air, light, and temperature. So the humidity that you're talking about, okay? Sometimes it's not a cotton ball anymore. Call it a desiccant. desiccant. It absorbs the moisture or protects it from moisture. One of the no-nos of nitroglycerin is do not put it in the bathroom. Why? Your light and temperature.
Put it in the dark.
Yeah. So if you have those medicine cabinet that shuts, it's okay. Okay? But do not put it exposed right next to the sink. Okay? Next. In 1937, I talked about this as a story in the audio lecture. More than 100 individuals died as a result of poisoning from a sulfa drug product that contained DEG or diethylene glycol. This tragedy led to the passing of the Food, Drug, and Cosmetic Act. I said 1937. That should be a tip, right? Okay. So the first law is 1906. Then something happened in 1937 before the 1906 law was enacted in 1938. It's on the first page of the lecture packet. What happened in 1937? They added the cosmetics, but what happened? What was that incident? DEG is an antifreeze that we put in cars. It was contaminated with diethylene glycol. And what happened? 100 patients died. Okay? Good job. Oh, by the way, before I forget, on the PTCE, you will not see abbreviations of laws. But on this final, the Poison Prevention Packaging Act of 1970 is abbreviated as PPA in the options. PPA of 1970. On the PTCE, we don't abbreviate. Okay? In case you're wondering, like, oh, which one do I choose? Okay, whoever wrote that question abbreviated the Poison Prevention Packaging Act of 1970. Okay, but don't worry, on the PTCE, it's going to be the full name. Okay. To combat and control drug abuse, this law was passed. Well, the DEA was created. What was that law? Very good. Controlled Substance Act. So some questions here are abbreviated as CSA. What year? Excuse me. 1970. Controlled Substance Act of 1970. HIPAA, HIPAA, not double PA, not a female hippo. No, that's not a female hippo. HIPAA stands for? You better answer. Health Insurance Portability and Accountability Act. What year?
1996.
Okay. What does it pertain? Give me one word. What does it pertain? What does that law? What does? Give me one word when you hear HIPAA. Privacy. What else? Protection. What else? Letter C.
Oh, I have it.
Very good. Confidentiality, not classified. Though there were a lot of files that were declassified yesterday. Anyway. I think Jessica and Kathy deserves a sticker. Gato will get a Gato sticker. Is it a gato? Okay, I wasn't sure. It looked like a cat to me. And keep answering, huh? This sounds more like Jessica. Don't talk to me. I'm counting. I have to pick for you guys. I'm sorry. Yeah, based on your personalities. My students were online. Were asking, can you sell those stickers? I said, I'll think about it. We'll see. Okay, let's continue. Keep answering. Keep answering. It's waterproof, by the way, so you can put it on your water bottles. I think gone are the days when students like chocolates and candies for prizes. Okay, I've heard other instructors say they love stickers, at least for their classes. So I don't know. You agree? Okay. You do too? I can see. Oh, you printed yours? And oh man, you're so crafty. Okay. Which schedule of controlled substances cannot be refilled? Very good. Schedule 2. Okay. Ugh. You can answer this, Yami. What are the limitations from the USPS, not UPS. UPS is brown and yellow. USPS is red, white, and blue, okay? My mom always confuses that. You have a package from UPS. I said, huh? I don't think so. Maybe USPS. It's confusing, right? Okay. So USPS is the United States Postal Service. Yami presented this, so I think she can answer. What are the limitations from the USPS for mailing drugs? A, only non-controlled drugs can be mailed. Yes or no? No. Yami said no. Let Yami answer so I can give her a sticker. You already got your stickers, okay? But answer in your head too. Okay. And then Steve has been answering, so I'm going to direct the next question to Steve. Okay, next. Without proper medical licensing, you can receive prescription drugs, but you cannot mail them. Without proper medical licensing, you can receive prescription drugs, but you cannot mail them. You? This is your report. No, it's situational. It's not in the lecture packet. It was in the presentation.
You have a license? Like, you have a license?
You can receive a drug.
You can get it, but you just can't.
Yeah, but you cannot mail it out if you don't have a license. Each pharmacy who does mail order should have a mail order license or a pharmacy license or a business license to operate. Is that clear? Okay. Yes or no? It's still yours.
Yeah.
Controlled substances have to be mailed by your doctor.
No.
There are no restrictions as long as you tell them. Where are my stickers?
You can't receive them, but you can't mail them. Only pharmacists do that.
I think this is more yummy.
What is that?
This is pharmacy technician. Okay. Steve, you're next, then Ty. I haven't heard Ty much.
Oh.
Who can accept a C2 prescription that is submitted via phone or phoned in? Pharmacy technician, pharmacist, pharmacy clerk, store manager. Pharmacist, okay? You may pick up the phone, okay? But you'll have to, since it's phone in, you have to get the pharmacist as well. I think this is for Steve. What do you think this is? Okay, I put the pro in propofol.
Oh.
You're welcome.
Oh.
Whew. Cool. Okay, Ty, your turn. As you look at the packaging of controlled substances on the pharmacy shelf, which designation on the label indicate that the drug is of the highest legal abuse potential? Okay, there's something wrong here. You should not see this in the shelf, though. So this question is wrong. As you look at the packaging of the controlled substances on the pharmacy shelf, there was a tip there. Which designation on the label indicates that the drug is of the highest legal potential for abuse?
What is not supposed to be on the shelf? It's supposed to be in a locked area.
Very good. So what schedule is that?
It's Schedule 2.
C2 or Schedule 2? That question was wrong. It should not be in the shelves. Can C3, C4, C5 be on the shelves?
No.
Yes. Where is C2 found? Locked cabinet. We call it a safe, but here's the rule. Double locking cabinet. Okay. But Miss L, we only have one lock in our pharmacy in the safe. You know why? The first lock at the door is considered the first lock. And then the lock or keypad on the safe is a second lock. Okay. However, that's retail. In hospitals, nursing homes, assisted living, all controlled substances are in the safe. Okay. This is for Ty. Pharmacy chaos coordinator. You agree?
Yeah, I know.
Not only here, but at home too. I'm waiting on Rainy. I'm gonna give him pharmacy babe. Just joking. I just saw it. Who regulates state pharmacy practice or practices? USP, NABP, FDA, or State Board of Pharmacy? I said the answer on the question. Who regulates the state pharmacy practices? The state by state board. So the State Board of Pharmacy. You were in a hearing. You know they regulate pharmacists, pharmacy technician, and the practice of pharmacy in our state. Well, California has their own. Okay? Every state has their own. And this State Board of Pharmacy is under a bigger organization called the NABP, National Association of Boards of Pharmacy. And what does the NABP do? They regulate pharmacists and pharmacy technicians in the whole United States. Who can issue a recall? Yeah, that's correct. The manufacturer can issue a recall if it's voluntary. Very good. If the manufacturer is not in the option, it's the FDA. You did this activity yesterday. Recalls, right? Okay. Which law, this is for Justin, which law helped the generic drug approval process to be streamlined, providing they demonstrate bioequivalence? So they can create a generic drug, in other words, okay? However, it has to be bioequivalent. Remember I talked about this? If there's 500 milligrams acetaminophen in Tylenol, the generic Tylenol must have 500 milligrams of active acetaminophen. Remember? First day I lectured, I talked about it. What law is that? It has something to do with generic streamlining. You have a chance. I think everybody can get one. There's so many questions. There's 51 questions.
Oh. Drug price competition and parent term restoration act.
That's not in the option. It's actually in your PowerPoint, not on the lecture packet. Yeah.
In 2010?
1984 is the tip. Yeah, I heard you. The Hatch-Waxman too. Remember, back in the day, it was 17 years patent, right? The manufacturer can request an additional 5 years. Hatch-Waxman, okay? And then they streamlined that to 20 years before a generic can be created, okay? So it still falls under the Hatch-Waxman. I guess I cannot give the certified pharmacy technician yet, but after we do a review and you guys start passing, I'm going to give out the certified pharmacy technician stickers and pins. This is for Justin. One does not simply put pills in a bottle.
What does that mean?
Oh.
What is that? You put it down.
I'm like, I know this, but let me write it down.
You know, pharmacists and pharmacy technicians get insulted by patients all the time. Like they think it's McDonald's. How long does it take to put pills in a bottle?
No, but if I gave them the wrong amount, they're gonna get mad.
Yeah. And they think we could offer a side of fries. Yeah. They don't know that there's adjudication process, that we have to input a prescription. We got to make sure that it's the right drug, right patient, right amount. Okay. Calvin, which would not be a breach of confidentiality? Two pharmacy employees discussing a patient's treatment in front of the patients. Breach or not breach? Okay. Calling out a patient's name and medication in the waiting area. Mr. John Smith, your Viagra is now ready. Breach or not breach? Calvin, I'm talking to you.
Oh, that's a great.
You just have to say breach of confidentiality or not a breach of confidentiality. Calling out a patient's name and medication in the waiting area. Breach, okay? Telling a patient of another patient that is on the same medication. You know, if your Mr. John Smith is on Viagra, my Mr. Show is also on Viagra. Breach or not a breach? Breach. Asking a patient if they have ever taken their prescribed medications before. Breach or not breach? Not a breach. Have you taken this prescription before? Did you have any allergies? Not a breach. Okay. Are you okay with your current medication? Okay. Did you experience anything, any side effects? Okay. Before you refill. Okay. Let's see. I don't know who has a dog. Raise your hands. I know it's got a cat, but I only had one cat. I like this one. Pharmacy with pills. If I don't have like anything, I just choose it based on color, so it's more masculine versus giving them pink and blues, or giving you a pharmacy babe. No one wants to be a pharmacist. I have a lot of future pharmacists here. Miss L, I don't want to be like you. It sounded like my son. Reporting your side effects of a medication is only for new drugs, done by your doctor, mandatory, or voluntary.
What was the question?
Reporting your side effects. Is that mandatory or voluntary? It's voluntary. If I don't want to tell it to anyone, I'm not going to tell it to anyone. If I thought, I'll just suck it up. Because remember, it's always a double-edged sword. You take the bad with the good. Now it's up to the patient whether it's okay, I can handle the side effect because the benefits outweigh the risks, or the side effect, or I cannot, I tried, I really can't handle the side effects. I got to go to my doctor and request for a change of prescription. So it's a voluntary reporting. Okay. Next one. A mutual principle for both pharmacist and pharmacy technician is both use discretion when counseling patients. Very good. You don't counsel patients. Only pharmacists counsel patient and pharmacist intern. They're allowed to, but most of the time they're still scared to counsel. These are the ones who are pharmacy students that are out on their internship. Okay, most of the time they're scared to counsel because they're thinking I'm still a student, but legally they're already allowed to counsel. Pharmacist intern, not yet. Both are obligated to discuss medication concerns with doctors. A mutual principle for both pharmacist and pharmacy technician is both must comply with applicable laws and regulations, no matter what. You pharmacists and pharmacy technicians have to comply with laws, okay? Laws govern everything that we do in pharmacy. That's why we have to study it. The way you fill, the way you file, the way you record, the way you document, whether you can counsel or not. Everything we do in the pharmacy is governed by a law, okay? That's why it is 12.5% of the PTCE. This question doesn't show up on the PTCE, but I'll let Josh answer this because it's his report. Okay? This doesn't show up. The PTCB will not ask you how many questions are on the PTCB exam. And the answer is, Josh? And the answer is, how many questions are on the PTCB exam? 90 questions, okay? 10 of that is not scored. Random. You don't know which one is not scored. It's just a way for them to test whether the population of test takers know this particular question. It may be in future tests, okay? So you hope that you answer the scored ones correctly, right? Okay, very good. Oh, Josh. You don't have a dog. Okay, you choose.
Oh, I get to choose.
Because there's a lot of things.
Oh, the dog is so cute. Can you hold that up?
The dog is cute. It says, trust me, I'm a doctor.
Oh my god, that's so cute.
He said I can take pigs, and so there are pigs in here.
Remember
To crush or not to crush? I like that one.
That was cute.
Yeah.
What do you not crush?
liquid tear.
Of course you cannot crush liquid, okay? Anything that has an abbreviation after the tablet or the capsule. ER, extended release, ER. Okay? What else? XL. XL is also extended release. FA, fast acting. Okay? EC, enteric coated. It defeats the purpose of coating the tablet to not be affected by the gastric acid. So do not crush those things. Cut, do not cut. Crush, okay? So EC, long acting, short acting, enteric coated, fast acting, okay? You do not cut, crush. That also shows up on the PTCE. Okay. Next one. What is the penalty for committing negligence? What is the penalty for committing negligence? Automatic termination, jail, fines and jail, or just fines?
No?
Who says fines and jail? It depends, right? It depends. Let's say minimum. What did you witness? Fines. But if it's a regular thing, yes, you're right. Like, you see how when we were at the state board hearing, back in, this doctor also did this and this and this. They dig into that. And so that will matter too, right? So, but if it's a minimum, the answer is fines.
Probably like the 500,000.
Okay, this is for Ashley. Okay. The Controlled Substance Act of 1970 established a blank, what organization, which is the agency responsible for determining the scheduling of controlled substances. What organization was created during the Controlled Substance Act of 1970?
Is there options?
No, because the answer is easy. Stop, Rainy! But it's rainy. So what is it? The DEA. Sounds like she's not sure. So I'll give you another one, another chance later. Okay. You again. MedWatch is a program under the... I cannot get an answer that's a question mark at the end. MedWatch is under the... I'm talking to Ashley. MedWatch. I differentiated this to organization many, many times. Do you have a dog? No. So the Controlled Substances Act, they created the DEA. I wrote it down the first day, right? MedWatch is what? The reporting of what? Side effects, adverse effects, right? Adverse effects. So whose program is MedWatch? The FDA. Remember that. FDA is the organization that runs MedWatch. Okay. What's the difference between side effect and adverse effect? Side effect, the word is known. Adverse effect is unknown. Okay.
I think she's a pharmacy lady. Not a dog.
Oh, she chose We Are Family. I like that. We are family. Who does the final check on a new prescription prior to selling it? Pharmacist, always. Brand and generic must be bioequivalent based on Red Book guidelines, state standards, FDA standards, or DEA regulations. Brand and generic must be bioequivalent based on, who said that? Which standards? FDA. Remember? Food, drug, and cosmetics. I forgot to mention that your dyes, food coloring, is under the FDA as well. That's why, who's baking? Hands up. Who bakes? Okay. That's why when you use food coloring, you see FD&C yellow number, because that's food, drug, and cosmetics yellow number. That's what it means. You didn't know? FD&C yellow number, FD&C red number. That's food, drug, and cosmetics. That's why it's FD&C. So there are many food colorings that are usually getting recalled because of allergic reactions, okay? A lot of our red snacks are banned in many countries. You know that, right? Your red vines, your hot Cheetos, okay. Why? Why are they banned in other countries? Red 40, okay. When I had an exchange student from Thailand, she was like, the first thing she grabbed at Walmart was all the bad ones that they don't have in the US, in Thailand. Like red vines, all the gummies that we have, trolleys. So anyway, next one. Which act, I said this in the audio lecture, which act gave incentives to manufacturers to develop drugs for individuals with rare diseases?
Orphan.
Okay, so orphan drug is what you call the drugs that are created for people with rare diseases affecting fewer than, what's the number?
200,000.
200,000 people. That's small. Okay? So because the manufacturer or the pharmaceutical company will not make enough money to recover the cost of clinical trials and their investment, what the government does is give them a tax break from that. So that we could answer or give, or manufacturers continue to discover drugs for this small group of people, small population with that particular disease. A lot of autoimmune diseases don't have millions affected, okay? Like 200,000 is the number that shows up on the PTCE. First question, what is an orphan drug? An orphan drug is a drug that's created and only affects how many number of individuals? The next answer is 200,000 patients or individuals or people. The next question is, what law is that under? Many of the laws have a giveaway, okay, which is if you know the title of the law or what it contains, you know the answer. You know the title when you know what it contains. Like in this one, it's about orphan drugs. So the title of the law is Orphan Drug Act of 1983. Okay? You don't have to memorize years. Okay? That's why if you heard me, I made it like a history class. Like, oh, what happened next? And then what happened next? I talked about the flipper babies too. You remember that? Bless you. Controlled substances are categorized based on Rainy. Controlled substances are categorized based on strength. Remember, the lower the number, the
high potential of abuse.
very good. The lower the number, the higher the potential for abuse. So C1 is more addictive than C2. C2 is more addictive than C3. C3 is more addictive than C4. C4 is more addictive than C5. Okay? Back in the day, before 2010, hydrocodone was C3. But because it's not only oxys that patients abuse, they also abuse hydrocodone, which is less potent. So what the DEA did is they reclassified hydrocodone to a C2. Another example, tramadol. Tramadol used to be not controlled. Okay? It is not a true opioid. It doesn't fall under opioid, but people started abusing them. Okay? So the DEA reclassified tramadol as a C4. Okay, so during that time, they just finished filling those refills, prescription, because tramadol was non-controlled. So how many refills? For non-controlled, 12. And then it became a C4. How many refills? 5. Okay.
You don't even know, right? He chose pharmacy, babe.
I like the magical pills. Okay. Next one. The ethical implications of providing drug risk information to patients when you tell them, oh, so the patient was given statins. Right? You say that, pharmacists should say that, do not take grapefruit or grapefruit juice with it, right? Okay, so that's an ethical, right? Ethical drug risk information, okay? If it's negative, you should not tell the patient. True or false? False. You have to tell the patients the risks, right? Best to only give minimal information to not overwhelm them, right? Education is part of our job, okay? Well, pharmacists specifically, the counseling part. Only tell them the good effects, okay? So if you provide drug risk information to patients, sometimes the ethical implication is non-compliance. Why? Oh my God, this is what's going to happen to me based on the counseling of the pharmacist. This has this side effect. I don't want to take this anymore. You get it? They won't comply once they hear the negative effects. So that is the implication of telling them the risks. Okay. You get it? Okay. Okay, this one I talked about this. Where would a patient find the chemical structure of their medication, Sam? Could they find it in the package insert? Could they find it in the prescription label? We'll have a sticker so big. Could they find it in the prescription? Or could they find it in the manufacturer monograph? The best answer is the manufacturer monograph, okay? Second best answer, because product inserts sometimes have the chemical configuration of the drug, okay? And just so you know, a product insert is considered a monograph. Anything that has a description of the drug is considered a monograph, okay? So best answer, you should choose monograph, okay? If monograph is not there, product insert, okay? And vice versa. There are 51 questions on law. I'm only going to take 50, okay, which means you got a bonus 1 point, which is 2%. I'm asking you more questions, so don't bank on, I got 51 questions now. I'm asking you more questions if you notice. I segue for the PTCE information. So don't rely on, I already have 51 questions. So no, I ask you more than that. Okay. To maintain, Josh will answer this because it's his report and he hasn't reported yet. To maintain certification, the PTCB requires how many hours of CE?
20 hours.
20 hours every 2 years. 1 hour must be?
Law.
And the other hour must be?
Safety.
Patient safety. Very good. Okay. So 18, you can choose whatever topic. 18, you can choose whatever topic. Okay. But you have to have 1 law and 1 patient safety. Okay. This happened to me before. One of the categories that I have over 20, one of the categories I didn't realize I didn't have patient safety, but I had more than 20. They're not going to renew your certification. The condition 1 hour law is a must. The condition patient safety is a must. So when you're taking CEs, make sure, okay, when you're taking CEs, make sure there's 1 category that says patient safety and another category that says law, okay? Or you can attend a board hearing, okay? And then keep monitoring your CEs through the NABP with your e-profile account. You remember that? So every time you take a CE, you plug in your NABP number, it automatically registers it. Okay? When do you renew? You don't have to take the PTCE every 2 years if you keep your certification up to date. I had a sub back in the day. She made her PTCB certification lapse. Why? She did not do 20 CEs. So she had to retake the test. For you not to retake the test and keep that certification, you have to put on your calendar your anniversary. Okay? You renew every 2 years of when your initial certificate was issued. Are you following? Every 2 years. Nevada pharmacy tech license is renewed every 2 years of even numbered years, October 31st. That's not the same as PTCB certification. You have to remember your anniversary every 2 years. So the moment you get your passing score and they issue your certificate, you will see effective date right there, okay? And you will see the expiration date. If I were you, if the expiration date is September 20, 2 years later, I'll put it on my calendar as September 1st. Okay, why? It allows you, if you forgot to do CEs, a couple of days to do 20 CEs total. Another thing, always remember, if you need law CE, our state board, every state board has a law CE in a Zoom format, pre-recorded, that gives you about 2 CEs that covers it, okay? But what happens is you print that out, so you have to submit that manually, okay? Where do I get CEs? Okay, back in the day, I get it from powerpack.com because it was free. POWERPAK.com. But now I do not recommend that. Okay, CEs may cost $1 per CE to $20, $30, $40 per CE or higher. Okay, so it's cheaper to be a member of an organization. Because if you're a member of an organization, they charge sometimes $39 a year, and you can take as many CEs as you want. One of the organizations that I go to is NPTA. Okay? And they have a lot of CEs for technicians. You have to take technician-specific CEs, not pharmacist CEs. Is that clear? Okay, so be a member of NPTA. I can't remember how much they charge annually. NPTA is the one that issued your IV cert. Another thing, if you graduated from PIMA, okay, and you did your IV certification, you get 40 CEs right off the bat for finishing the IV cert. If you check, we're the only school that does that in the entire state of Nevada. We're the only school that has an advanced accreditation in the entire state of Nevada. That's on your belt already before you even walk out these doors. Okay? And that's why even if hospitals require 2 years of experience before they hire you, how many students were hired? How many of my students were hired at hospitals? Almost everyone who externed at hospitals. They don't look at experience anymore because you're IV certified. You're good. Emily just got an offer yesterday and she signed the offer from Spring Valley Hospital. And she also passed her her PTCE yesterday. They disregard that 2 years experience in the requirements. And you know, I'd like to read to you the comment of the pharmacist who worked with Emily in the IV room. I'm saying this to honor Emily and to serve as an example, okay? It was a pharmacist who worked with her in the IV room. Emily is very diligent with her learning and participation. She has exceeded all expectations regarding assignments and tasks and demonstrates excellent work ethic. Roles given: rounding technician, counter technician, assisting where needed, no problem with attendance. Okay? On her IV rotation, that was her PO side, okay? Outside the IV room. Here's her IV rotation comment. Emily came in with a knowledge and practical base that was way above average regarding IV compounding. You know why we do that? They didn't have to teach her from scratch. And that's why they bypassed that 2 years requirements. Okay? I have personally evaluated and trained her in the techniques of sterile compounding, and she has performed excellently. She gets along with staff and pays very good attention to her training and development. I would recommend her to any site or program. There was no opening at Spring Valley Hospital, but the pharmacy director made an opening for her. Yeah. So sometimes like the timing, but sometimes pharmacy directors have that power. Sometimes it's HR directors that has more power. Like we really don't have budget. Okay, but here's one thing I'd tell you. My guess, though, Emily didn't say if it's for per diem or full time. My guess is per diem. Okay. You cannot have too much of a per diem pharmacy. Per diems usually make more than full timers. Why? Because why do per diems make more than full timers? They don't have a set schedule. They don't have what? Most per diems, they don't have benefits yet. Okay. So you're going to be capped at a certain number of hours. Okay. In a year. But usually once it gets closer, you tell your pharmacy manager or pharmacy director, I'm getting closer to my 1,000 hours. Okay. And you say, is there an opportunity for a full-time? Okay. And remember, Spring Valley Hospital is under the Valley Health System. So Emily can float at Henderson, Desert Springs. What else? Summerlin, Centennial Hills. Okay. Yes, Mr. Jenkins.
Hi, good morning. Sorry to interrupt, but I have to find out if your cars are parked in a certain area that I need in the room, because I have some lighting work being done right now. So please listen for these tags and cars if they belong to you. Move them. All right, cool. First one is a black truck with disabled, better disabled tag on it, B418. Anybody? No. Truck, Tacoma, Toyota, white, 285, B88.
I think just say the model, and then if it's not their model,
Okay.
yeah.
Honda Accord. Am I wrong with Accord? Toyota.
That's you. Camry.
It's like a beige or something like that.
No one? Okay.
And a black 4Runner. Toyota. Oh.
Okay, then say the plate number.
Okay, license plate 569 W78. Are you parked right over here? Where the brake-
That's you?
Right where the brake is, where the brake is? Yeah, so now, I need you to move it anywhere other than Eric, because I got a truck that's pulling up there.
Okay. Any more?
That's it.
That's it. Thank you.
Thank you.
Thanks, Calvin.
Chapter 1.
Not you, Jessica. Okay. Okay, I talked about this in the audio lecture. Books, remember references? Did you get to that audio lecture? Yes. There are color books. Don't expect them to be that color, the original color of those books. But the ones that usually show up, take note, the ones that usually show up are the red book, the orange book, okay? The Trizzles handbook. Trizzles, take note. Trizzles is the injectables. Take note of that. That shows up on the PTCE a lot. The list of injectables or injectable drugs is called Trizzles. TRISSEL''S. You heard me say that in the audio lecture? Okay. What's the difference between the red book and the orange book? That's in your lecture packet. Injectables. This shows up on the PTCE, the Trizzles.
Is it one for pricing or the one's just like general?
Yes, you're on the right track. So which one is for pricing? The red one, okay? Average wholesale price, price of HIV medications, okay. The orange book, we call it the orange book, but it's actually therapeutic equivalence book, okay. And there's one that Miss J and I didn't know about, and it's the answer to this question, okay. It's on your book, it's on your textbook. Generic equivalents of a brand name drug can be found in the electronic or hard copy version of. The answer is the purple book. I'm sorry. It should be the orange book. Okay. The answer key was wrong. Okay. Generic equivalents is the orange book. Okay. It's my favorite reference for pharmacy. Why? It groups that book, hard copy or soft copy, it groups the drugs by therapeutic class, meaning by use. That's why it's awesome. So if I'm looking for antihypertensives, I just go to that section or chapter. Is that clear? So the orange book is the generic equivalent, or the real name is therapeutic equivalents. Okay, there is a purple book, but it doesn't usually show up on the PTCE. Red shows up, orange shows up, trizzles show up. Is that clear?
Not the purple book, you said?
There is a purple book on your textbook, okay? It doesn't usually show up though. Okay. What does PHI stand for? Always show up on the PTCE.
Patient health information.
Patient. Is it patient?
Health information?
It's not patient.
Oh, patient.
Jessica, you reported this.
Personal health information.
Protected. Because it's confidential, remember? PHI stands for Protected Health Information. Okay. Justine's the only one without a sticker now, I think. Okay. You got one? You haven't gotten one. Sam. Okay, Sam. Protected Health. She answered that one, so it's good. One more for Sam. Which amendment separated OTC and prescription drug classes and mandated the federal caution statement? Which amendment separated OTC and prescription? This shows up. Remember I told you, these two drugs with legislator names always show up on the PTCE. So that's my tip. So it's either Kefauver-Harris or Durham-Humphrey. Which one? Correct. Durham-Humphrey is when they separated OTC from prescription drugs. So find Legend versus OTC. That's Durham-Humphrey. Okay. I'm going to buy certified pharmacy technician pins once your batch passes the PTCB and more certified pharmacy technicians. Not at all.
That one is so cute.
I know, it's so cute. I'm a doctor.
Oh, the dog says I'm a doctor?
Good. Yeah, because usually it's pharmacists. It's pharmacy. The younger graduates.
Yeah.
What did you choose? Oh, pharmacy technician. I like that one too.
That one's called my next
I
one.
like the magical pill. Everybody got one at least? Yeah? Okay. Everybody got one at least. I mentioned this. It shows up on the PTCE. What class are anabolic steroids? Always show up on the PTCE. No! No! You're guessing. It's 3. Always show up on the PTCE. Okay. Speaking of anabolic steroids, remember I told you a story about the...
The bicyclist. What? Oh, no, you were-
Yes, yes. And the horses.
Oh my God.
Yeah? Yeah, and the horses. Okay. Okay. Each what law was that governs anabolic steroids? There you go. It's in the title. Anabolic Steroid Act of 1990. Okay. Let's go back to PHI. I asked this from Jessica when she was presenting. Which is not considered a PHI. Okay. A copy of your insurance card, is that a part of the PHI or not? Yes, it's part of the PHI. Phone number, is that part of the PHI? Protected health information. Yes. Date of birth. Yes. What about child-resistant cap preference? It's not part of the PHI. Okay. Which act gave the FDA the authority to use a number code known as NDC numbers? I heard it. Drug Listing Act of 1972. Okay, NDC number always shows up on the PTCE. Here are examples. NDC stands for National Drug Code. How many digits? 10 or 11. The first 5 pertains to manufacturer. The next 4 pertains to product. And the last 2 pertains to package size. This is how they're going to do it. Okay? They're going to have a series of NDC numbers. Okay? They're going to have one NDC number. Okay? And they're going to choose either the 5 digits, the 4 digits, or the 2 digits. This is the NDC number. What does 01 stand for? And your options are manufacturer code, drug code, package size, or FDA code. Okay. So if it's the last 2, that is package size. If it's the middle 4, that is product or drug code. If it's the first 4 or first 5, manufacturer, remember that. They throw in 3 to 4 questions of that. Okay? Next one. Hopefully on Monday we have an answer from PTCB regarding our final price. Okay? It's 13, right? Yes? Okay. It's okay if it's extra. But okay, so this was supposed to be Ashlyn's report. Okay. Regulations are, say yes if that's the definition of regulation, say no if that's not the definition of regulation. Regulations are legislative laws passed by the state. Regulations are guidelines or benchmarks that serve as the expected norm. Let's put that on. Maybe. Regulations are written rules or procedures that exist to carry out a law. It's defined in your PowerPoint verbatim, like that. Okay? So, regulations are written rules or procedures that exist to carry out a law. Remember, my example was your traffic violations, NRS.
Yeah.
Okay. That's a state law as well as it's a regulation to carry out traffic rules. Okay. NAC, Nevada Administrative Code. It's also a regulation to carry out federal law, state laws. Okay. To maintain CE, we done that. Okay, this one. What modification did the Durham-Humphrey Amendment make to the Food, Drug, and Cosmetic Act? It's in the lecture packet. And there's a definition, and I wrote the differentiation of the two. What happened in the Durham-Humphrey Act? This shows up on the PTCE.
They didn't make the labels, so it said.
They differentiated what?
Legend and over-the-counter.
Very good. That's it. It's as simple as that. They differentiated legend versus over-the-counter. And legend means prescriptions only. Prescription only. And OTC stands for over-the-counter. Almost there. I'm making sure we covered everything. Which staff member is allowed to counsel patients? Pharmacist. If there's an option for pharmacist intern or pharmacy intern, you include that too. Okay. because they're both legally allowed to do that, okay? The term ethics refers to ethics. The term ethics refers to following state laws, yes or no? The customer is always right, yes or no? Following your beliefs for the best care of the patient, yes or no? You presented conscientious objector, your personal beliefs, okay? Or is it the standards of behavior that all pharmacy technicians are encouraged to follow? Okay. It's a standard of behavior, is the other word, okay? What is a situation that calls for a decision between two or more solutions? I don't like that wording, but it was worded like that in your pharmacy, in your finals. What it meant is when morals, okay, conflict, when your personal morals, when your own morals, when your morals conflict with job, what do you call that term? No. I told you it's blank dilemma. Ethical or moral dilemma, either one, okay? Certification, what is the definition of certification? This should be Ashlyn's report, okay? Certification versus registration versus accreditation. I'm going to define them, okay? So accreditation, Ms. J discussed that. It's ABHES, ASHP, okay? Accreditation, and another one would be what? The TJC. TJC accredits who? Hospitals. The Joint Commission. Take note. That's on the PTCE, TJC. They used to be called JCO. Now they're called TJC, the Joint Commission. They accredit hospitals. They check for the cleanliness. They even check the cafeteria menu. Okay? They check the roles and responsibilities. In a school, we have ASHP and ABHES. ASHP is for pharmacy and pharmacy schools and pharmacy training programs. Okay? And ABHES, okay? So it's one or the other for you to take the PTCE. But we have both accreditations. Okay? So if you're asked, did you come from an accredited training program? Yes, the answer is that. So that's accreditation. Wherein an organization, usually a nonprofit organization, comes in, checks whether you're doing the right thing or not. Examples of accreditors are TJC for the hospital, ASHP and ABHES for pharmacy schools, okay? ABHES for pharmacy technician schools, and other allied medical professional schools, okay? That's accreditation. Registration, I mentioned this in passing. Registration, here's my question. Are you registered as a tech in training in the state of Nevada? Yes. You are registered, meaning you're part of a list. You're part of a database of professionals. Once you finish the program, you're going to register as a full-on pharmacy technician. Then your license gets flipped from a tech in training to a pharmacy technician full license. You are registered. Remember, why is that important? When there's an emergency, a national emergency, a worldwide emergency like the pandemic, they know who to tap into, the database. Remember, I received a letter asking volunteers to immunize. Same way. Okay, there's war. Those are the things that. So that's a registration. What's a certification? A certification is when you take a test or a validation. Are you copying? So the PTCE is a pharmacy technician certification exam. That's why they call you PTCB certified. The ExCPT by the NHA is an exam for the certification of pharmacy technicians. And what is that? Another certification program. Those two certification is called a national certification. When you graduate from PIMA, you get a certificate of completion from an accredited, an ASHP and ABHES accredited pharmacy technician training program. Are you following? So certification is either getting tested or validated. Can be a practical exam, a written exam. The whole 9 months you were here, you're getting certified to be a pharmacy technician. But a better picture example of that is the PTCE and the ExCPT because it's national. Are you following? That's the difference. So are you registered as a tech in training in the state of Nevada? Yes. Who does our registration? Who do we register to? The Nevada State Board of Pharmacy. Good job. This agency, it's on your lecture packet, is a division of Department of Labor, ensures the safety and health of U.S. workers. I always say this. That's why when you're in a construction industry, you have to wear hard hat. When you're working in a restaurant, non-slip shoes. OSHA. Okay, OSHA stands for
Occupational safety,
she works with the union. She's under a union, so she should know this.
I don't remember the age. Very good.
Occupational Safety and Health Administration. Good job. Okay, tell me if this is civil law, ethics, regulations, policy, and procedures. Following a code of high professional standards is defined as ethics. Legislated rules and procedures that exist to maintain minimum public safety standards is the definition of criminal law, ethics, professional policies, regulations. Regulations. Which of the following regulatory bodies sets high standards of care for a hospital? I just mentioned it. And only accredits those facilities that pass a rigorous inspection.
The joint committee, the joint commission.
TJC, the Joint Commission. When it's an accreditor for hospital, the answer is TJC. Okay? Tell me if it's a responsibility of a state board of pharmacy or not. Say yes if it's a responsibility of the state board. Say no. You've been to a hearing, so you pretty much have an idea what state board does. And you've registered as tech in training. Tech in training. Okay. Do they schedule pharmacists?
No.
Do they provide continuing education? Well, yes, too, for our state board, yes. Yeah, so put that on the side. It might not be the best answer, okay? Do they interview pharmacists and technicians for the job? No, unless they're applying for the state board job, right? Do they safeguard standards of public health, safety, and welfare? That's the best answer, okay? You've witnessed in a board hearing, okay, that they truly are safeguarding standards of public health, safety, and welfare. So even doctors get trialed.
That was fun.
I know. Okay. Which one cannot write a prescription? Can ophthalmologists write prescriptions? Yes, they're doctors, but not optometrists. I mean optician, not optician. Okay. Ophthalmologists are doctors, so they can. Okay. Can doctors write prescriptions?
Yes.
Can dentists write prescriptions?
Yes.
Can psychiatrists write prescriptions? Can pharmacy externs write prescriptions? No. Depending on the state, pharmacists may write prescriptions. Usually, smoking cessation drugs like Wellbutrin, and this time, there are certain states that allow pharmacists to write prescriptions for COVID. Okay? COVID treatment. Okay. Which of these does not need to be on the prescription label? Say yes if it should be part of a prescription label, not a prescription. Say no if it should not be part of a label. Okay, you've been working a lot with labels, right? Okay, quantity dispensed. Yes. Patient information. Drug name, quantity, and strength. What about DEA number? No. The DEA number is not required to be on a label. However, it's required to be on a prescription. If the prescriber is prescribing controlled substances. Okay? Here's another thing. Okay. You do not have to have the patient's address on a prescription as a rule. However, if it's a C2, the patient address must be on a prescription. Okay? But many states, what they follow is if it's a controlled substance, the patient's address must be on the prescription. Is that clear? Okay. Each state board of pharmacy, I just mentioned this, is overseen by a bigger organization called, very good, NABP. Under the NABP are different state boards. Under the NABP are pharmacists and pharmacy technicians. So they regulate pharmacists and pharmacy technicians, and they also regulate the different state boards. That's why it's called NABP, National Association of Boards of Pharmacy. The CDER, remember this? Center for Drug Evaluation and Research does not do what? So say yes if they do that, no if they don't do that. New drug development and review. Do they do that? Yes. Generic drug evaluations. Do they do that? Do they do recalls?
No.
Who does recalls? FDA. Do they review OTC drugs? Yes. Good job, everyone. Any questions? No questions? Who did not get a sticker? You did? Any questions?
No. It would take 2 minutes to stretch.
Yeah. I'm going to give you 10, actually.